Hello there, I'm Kate Smiles from the Mind Body Reset, and I'm here today to talk to you about eating disorders. Now, eating disorders are a mental health concern relating to having a poor relationship with food for whatever reason. However, eating disorders are not actually about food, they're about feelings and how using food to exert control over one's life may make it seem easier to cope. Now, serious eating disorders consist of anorexia, binge eating, bulimia, and other specified feeding or eating disorder. All eating disorders can cause harm and may even become fatal. However, they can be very treatable. So if you're concerned about yourself or someone you care for, do get an assessment as soon as possible so that a course of treatment can be tailored to your situation and symptom pattern. Now, anorexia nervosa is where people limit their calorie intake in a bid to drop their weight well below normal. Exercise may also be excessively employed to aid this aim, both of which can do serious harm. Now, sufferers often have a hugely distorted body image, so see themselves as much larger than they are. Binge eating disorder can be very distressing. Rather than just eating portions that are excessive or overindulging once in a while, it consists of frenzied, uncontrollable bouts of eating, which may be spontaneous or planned and shopped for, and generally occurs in private and over and above proper meals. Those with bulimia nervosa are trapped in a cycle of binging and purging via vomiting, laxatives and diuretics to weigh as little as possible. As with anorexia, bulimics see themselves as larger than they are and will do anything to keep their habits hidden. Other specified feeding or eating disorder may include symptoms of anorexia but without low body weight, low frequency bulimic episodes, occasional binging with or without purging, a tendency to purge despite eating normally or even next to nothing, and nighttime eating. Now, if you recognise any of these signs, please do seek medical advice. Emotional eating, however, if occasional, may be less serious, but when food starts to be used to deal with emotional upsets, then indulgent eating shifts from an occasional treat to problematic, which keeps you on an energy peak and trough roller coaster. Physical hunger tends to build gradually, allows for a range of foods to be appealing, and is resolved after eating a reasonable quantity. Emotional hunger attacks suddenly, needs to be satisfied instantly, leads to cravings, isn't necessarily resolved by eating, and triggers negative emotions. Most people experience this occasionally, but may be fine after a glass of water, some breathing exercises, or a square of dark chocolate, etc., which is good. Or this drive to indulge may not be satisfied without a tub of ice cream, etc., which could be a sign of an underlying eating disorder. Now, if you notice you're starting to eat in secret, buy excessive amounts of food, high packaging, or become withdrawn, then your situation may be accelerating. Eating disorders of all levels are not the fault of the sufferer. They are an illness, just like it's not your fault if you get flu or cancer. It's also not your fault that your eating patterns are affected, but just as the concern isn't really about food, the treatment shouldn't really be totally focused on food either. We need to look into the triggers so the desire to use food to control may be eliminated before normalising dietary habits can be expected to be fully successful. Now, young women may be thought of as being most at risk of an eating disorder, but absolutely anyone can be affected. Genetic, environmental, social and biological influences can be triggers, but generally there's a complex mix of reasons with traumatic stress at its core. Now, treatment needs to consider three options: talking therapy, education and medication. Talking therapy can help unpick your stress triggers to work towards resolving or reducing their impact. Counselling, psychotherapy, CBT and hypnotherapy or sentimentology, plus mindfulness practices can all be invaluable. A nutritionist or dietitian can teach you about what nutrients are necessary and the benefits of food diaries and meal plans. Medication may be required to deal with any health issues caused as a consequence. Plus, friends and family as a support network are also important, but don't underestimate the health risks if left untreated, as well as digestive concerns, nutrient deficiencies, lack of periods, heart and muscle issues, plus depression, OCD and addiction. Eating orders also go hand in hand with dental erosion and cavities, plus stunted bone growth and osteoporosis. So if you're concerned about your health or that of a loved one, contact your GP, and why not call the Beat Eating Disorders helpline direct on 08 08 80 10 677. Now please DM me to ask a question, book a health boost audit, or request a discovery call to chat about how the Mind Body Reset could help you. Thank you for watching. I hope you found that helpful. Goodbye.